I'm going to ask us all to pause for a moment. As an educational institution, we recognize the importance of learning history and understanding the significance of the land our university is on. As a Catholic institution, we strive to uphold the dignity of every human being. Please share in the land acknowledgement with me. Inspired by Catholic intellectual tradition, we invite you to reflect on these scripture verses that offer us guidance in this endeavor.
Do not conform to the pattern of this world, but be transformed by the renewing of your mind. But someone will say, "You have faith, and I have works. Show me your faith apart from your works, and I, by my works, will show you my faith." The University of St. Thomas occupies the ancestral and current homelands of the Dakota people, Minnesota Makoche. We also recognize the Ojibwe and Ho-Chunk, whose lands were colonized by the United States and are currently occupied by the state of Minnesota.
We condemn the tools of settler colonialism, including genocide and forced assimilation, undertaken in the name of white supremacy that created structures of injustice and inequity that continue to oppress and marginalize Indigenous and underrepresented peoples.
We work towards the process of decolonizing minds and educating students to be morally responsible leaders. We commit to the work of truth-telling and relationship building as we seek new pathways forward as relatives in the University of St. Thomas community, the Indigenous communities, and those who traverse multiple communities.
Welcome to our First Friday conversation. For more than 30 years, St. Thomas alumni and friends have come together for the First Friday Speaker Series luncheons to hear firsthand from the community's most interesting thought leaders. Now, we're delighted to share these conversations both online and in person. The leaders we invite to this series offer candid messages and unique perspectives on the common good, and provide interesting insights into what may be next for Minnesota and beyond. Today's guests are no exception, and today's topic of advancing health equity and tackling health disparities could not be more relevant given the ongoing COVID-19 pandemic. First, we have Dr. MayKao Hang. MayKao was appointed Vice President and Founding Dean of the Morrison Family College of Health at St. Thomas in the fall of 2019. MayKao is a leader who is passionate about the well-being of the underserved communities and a champion of addressing disparities. In her 2.5 decades of experience, she has addressed disparities in children's mental health and in the number of licensed clinicians of color. She also worked to reform traditional county mental health and elderly services across the state and is an expert on addressing complex community issues and integrating behavioral health services. On campus, she has worked with faculty to develop new curricula, hired new faculty, and cultivated relationships with health provider partners. MayKao earned her BA in psychology from Brown University, her master's in public affairs from the University of Minnesota, and a doctorate in public administration from Hamline University. MayKao is truly an amazing force on campus, and we're so pleased she's with us for today's conversation. Joining MayKao is Jennifer DeCubellis, CEO for Hennepin Healthcare System. Jennifer has more than 25 years in public program administration, working across all areas of health and human services, with an emphasis on program redesign, system transformations, and quality improvements to ensure positive resident outcomes along prudent financial management. At Hennepin Healthcare, Jennifer oversees an integrated system of care that includes a nationally recognized Level 1 adult and pediatric trauma center, an academic acute care hospital, a clinic and specialty care system, a large psychiatric program, home care, hospice, and emergency medical services that serve 14 cities in Hennepin County. Prior to her current role as CEO of Hennepin Healthcare, Jennifer was a deputy county administrator for Hennepin County. responsible for health and human service operations, which included over 4,000 employees and a budget of over $1 billion. Jennifer has a master's degree in clinical psychology from the Illinois School of Clinical Psychology and a bachelor's degree in special education from the University of Wisconsin-Madison. MayKao and Jennifer, thank you so much for joining us. We greatly appreciate you sharing your time and your wise insights with us today. And thank all of you for joining us. Now, please enjoy the conversation.
Well, thank you so much, Julie, for that wonderful introduction. I'm so happy to be here and actually be with my friend, Jennifer DeCubellis. So welcome, and I hope you enjoy this conversation as much as I think I'm going to enjoy it. So welcome, Jennifer. I thought you could maybe start out by telling us about your journey into healthcare leadership. What were the pivotal moments in your education, career, or life that brought you to becoming the CEO of Hennepin Healthcare?
So thank you. And first of all, let me just say how honored I am to be here. And I appreciate the invitation. My journey into healthcare is not a straight path. And so as people are listening, we all follow our passions. And what I found is, as you heard in Dr. Sullivan's entry remarks, I have a background in special education, working with children with emotional and behavioral disorders. And what I found early on is I was teaching in a school in Chicago and was really working with young people age 8 to 21 who were in one single classroom and had high needs and were not achieving in school. Put a program together and working with them and their families, and ended up launching an article in the cover of the newspaper that really gave us accolades for how we had moved these young people into really investing in their education and learning and being inspired, doing homework, starting to read, starting to engage. And I was immediately called into the administration. And I was thinking, I'm 21, I'm a young teacher. I was thinking I was going to get praise. And what I heard was, Jennifer, you've got to stop doing what you're doing because it doesn't follow the philosophy of our school. And that was a pivotal moment for me because what it taught me is I turned in my resignation on the spot. And I'm a young individual living on my own and didn't know how I was going to pay my bills. But what was so important to me was I had to trade my values of either doing what I knew was right for these young people and what was working, or putting people into a program that's not working for them. And I would say that was a pivotal moment, and I have seen that as I have followed my career. I went into clinical psychology because it was the emotional side that I really wanted to help with and that I thought I could make a difference on. Journeyed here and got a little bit more into healthcare. And what I've really found is that we have way too many programs and structures that put people into programs versus making sure that programs are meant to help people. So I've really dedicated my career to making a difference, but not making a difference for the program I'm working for, the people I'm working for, making a difference for the reason we're all here, which is to serve the community and to truly make sure that our efforts are helping individuals at the end of the day.
Mm-hmm. Yeah, your passion really carries through. And I remember when I first met you, actually, I think we were just doing some shared work, and I'd heard about you long before I actually met you. But your values-based leadership, your focus on community, and your orientation towards whole person care, which is what the Morrison College is about, was really inspiring. And so we're just very lucky that you said yes to joining our advisory board on the Morrison Family College of Health. I couldn't think of anyone better, actually, to join us in this academic endeavor in terms of creating a new college. Can you tell us more about Hennepin Healthcare and your organization's mission and goals for the year ahead?
Absolutely. So Hennepin Healthcare is just an incredible organization that many know about, but really is the Minnesota's premier safety net health system. So we are often HCMC, Hennepin County Medical Center. A lot of people know us because of the trauma that we do. When on the slide here, you'll see I share that it's the Minnesota's premier safety net hospital, and that's even a misnomer because we serve the entire region. The trauma expertise that exists at Hennepin Healthcare is incredible, but I often reference it as a trifecta of healthcare because not only do we have incredible hospital acuity care, trauma care, primary care, community clinics, we have community paramedics. We really have an entire system of care that is operated under Hennepin Healthcare, but that trifecta is, imagine taking an incredible service model and adding teaching and adding research and innovation. And what you have is an organization who works for Hennepin Healthcare for the right reasons. We have incredible hearts and minds end to end across the organization who are here to serve the community, which is what drove me to joining Hennepin Healthcare. But in addition to that, we are a teaching organization. So teaching the future workforce across healthcare and beyond, and making sure that we take healthcare to that next level, that we truly transform the direction that healthcare is going based on what we see our community needs. This next slide shows you a little bit about the workforce of the future. So what do I mean by that? So Hennepin Healthcare provides training to over 50% of the providers that are across the state of Minnesota and from other states. And we are just an incredible organization that invests in the education and the training and the excellence for providers. And oftentimes people think we train just doctors. And that's an important role that we have. But we have over 70 professions that we train and provide that coaching and education. So we have providers that come to our organization because they're not just excelling in the work, but they want to teach and they want to create that bandwidth for others to learn. So that growth mindset means we're a great organization for looking at where are we now as healthcare, leveraging our research arm to say, and where do we need to get, and where can we go together? Over COVID and the pandemic response, we've seen the incredible ability to folks that have been trained at Hennepin Healthcare that are working in greater Minnesota and having to hold care levels at a higher level than they're used to. But they have this whole teaching organization that's at the ready. They have relationships. They can pick up the phone. They can call us. They can consult. And it really demonstrates the ability for us to be an influence across the entire state of Minnesota.
Mm-hmm. Yeah, I don't think that people often understand how special Hennepin Healthcare is in terms of having that web in the safety net system, the teaching and training functions, the research functions around really the most disadvantaged in society. And so, you know, when I think about how we need to move forward as a community, as all of Minnesota, or really if you look at nationally at some of the things that are happening in society related to the pandemic, but also the other pandemic of racism and discrimination in our society. I think Hennepin Healthcare has kind of a unique position in actually identifying what some of that looks like, how we can actually advance health equity. So when you think about the social determinants of health, which we know is 80% of what influences even the possibility of good health, how do you feel like under your leadership and vision, Hennepin Healthcare can work with our region and with Minnesota to actually advance health equity in our communities?
I think you highlight an important part. So at Hennepin Healthcare, we provide services to the patients that we see. 60% are people of color. 70% are on public programs, which adds additional barriers to care. And we have people that speak over 70 different languages. So we are an organization that sees at the forefront what's not working in healthcare when you look at the disparities. So it's well known that Minnesota is a top healthcare state. We tend to be the top 1, 2, 3, 4 in most health indicators. And as soon as you sort it by race, we're competing for 46th, 47th, and sometimes 48th in the United States, which tells you that it's not a resource issue. It is not a talent issue here. It is not a skill set. It's that our health system has systemic racism embedded in it and isn't working for the very people we're working to serve. So we have taken that as a charge because of the population that we have such a high service rate with, to say if anyone can figure it out, it's us. And we've got to do the real transformation of healthcare. Why aren't we meeting the needs of individuals? Why do we see higher chronic illness? Why do we see higher barriers to care? So we're really intentionally working on what are those underpinnings, listening to community, what matters to them in their healthcare, what do they need from us, and how do we drive a health system, again, to my earlier comments about not putting people into programs. Yeah. It is a super regulated organization or a regulated system in healthcare. And so how do we make sure that we're investing in undoing those systemic barriers that are getting in people's way for access and easy health?
Yeah, so a lot of conversation right now about insights gained during the pandemic related to social determinants of health. What insights or underpinnings have you learned about during this particular time?
Right away, we saw access. We chose actually it's the first time, and I've been CEO there for 2 years, and it was the first time I said, it's okay for us to fail. And what I meant was when we were trying to push out vaccinations even early, and we had dashboards across the state of Minnesota that said you had to get vaccinations out in 72 hours, and there was a public scorecard. Hennepin Healthcare was looking like it was behind. But what we were doing is we knew that we needed to do it intentionally because it wasn't about doing it fast, it was about doing it right. And the system was set up against the very people that we knew were disproportionately impacted by COVID. And so it was about going to the community. It was about doing pop-ups. It was making it easy, removing barriers. So if there weren't access to masks, social distancing wasn't always possible for individuals. Getting online quickly in order to get into a lottery wasn't possible. How do we do that differently? So it was talking to the community and saying, we'll come to you. We're going to make it easy and we're going to remove those barriers. So access was a huge one. And going to community and delivering care in the way that the community needed us to was another. And then community messaging was a third one. Trust in healthcare at this time wasn't there. So we knew we needed to have trusted community leaders that helped us engage with community in order to get them the health care that they wanted and needed, but in the way that they wanted and needed it.
Yeah, so I remember that happening actually with Hennepin Healthcare, kind of watching all the different figures, and people kind of couldn't figure out necessarily what was going on until the penetration actually happened with the vaccines with populations of color, low-income populations, and actually elderly populations that Hennepin Healthcare was reaching out to. So thank you for doing that work. A lot of times people think about advancing health equity as, well, shouldn't it go faster? And equity can actually take longer if it's going to be transformational, right? And so that's really what you were doing. And I think that outward progression was really insightful, useful, and absolutely necessary. So my next question for you is really around that shared commitment with individuals and communities, which has been so much a thread and a theme throughout your lifetime and career, mine too. What role do you think community partnerships play in this healthcare transformation? Why is that vital? And how have you thought about keeping people well versus just addressing people's needs when they're really, really sick? What role has the community played in the strategies that you've led, especially during this time?
We're talking a lot about partnerships because in healthcare there are incentives. And it's that infrastructure that we actually need to break for individuals to get into big structures, to have big systems, to keep closed networks. And actually, if we're going to do healthcare right now, the pandemic taught us more than anything how critical it was of everybody's health, how important it is to me that you're as healthy as I am, that my neighbors are, that everybody has care and access. So what we really have done is looked at the structures that need to change in that health inequities, and a lot of it is those partnerships. So we don't want people to have to come to us and just struggle to figure out our system. And the partnerships that we're talking about is there's people that are already in community, that community already trusts, that can bridge the social determinants, whether it is a transportation barrier, a healthcare barrier, a childcare barrier, unemployment barrier, that prevents people from being able to take care of their own wellness. Us creating a system of care that partners teams together and that individuals don't have to figure out how to get to all of us because we're making it easy for them and we're wrapping those supports around them, I think is essential right now. Because we have to make being well easy. It can't be a full-time job. And for people on public programs in particular, it's exactly what it is. It's a full-time job just to keep benefits, stay on benefits, jump through all the hoops that you have to try to get to an appointment. And we have an opportunity right now. We have technology that's making virtual healthcare a little bit easier. We have community partners that are opening their doors to us. And if we can all lean into that and not worry about our share of the pie, but to truly leverage each other, I think that's a game changer for the community.
Yeah. So one of the things, for example, we're thinking about doing in the college is how do we get whole person health and access at the point of intersection, and actually education delivered in places where the community is going. Yeah, right, because this is atypical. We have students, we're trying to educate them. How do we actually get them out into the community faster and in different ways? So I think a lot about telehealth, for example, and virtual access to healthcare during the pandemic, and some of the things that Hennepin Healthcare was doing around creating those points of access, not necessarily through technology. It's a little slower, right? So I've recently started thinking about libraries at the point of intersection where families go, and how do we create access points to technology? Because telehealth presumes that everybody has a mobile device, everybody reads English, everybody has money to actually buy these devices, but people really don't. And I think a lot about populations that you're serving through Hennepin Healthcare really being those individuals who deserve and need that support, but not often being able to actually access it. So when you think about like the type of accessibility issues, the whole person care, the community, the thinking about community wellness and well-being, how do you think we should be training our future health professionals within the College of Health? You obviously sit on the advisory board, and we just launched this School of Nursing, but because we're an educational institution, we're basically the suppliers of future talent into the health professions. What characteristics and traits are needed in today's healthcare workforce that have come to light, or that we need more so of now than ever?
Great question, and what we have repeatedly seen was that over the years, healthcare has gone from seeing themselves as experts to seeing themselves with patients as partners. And creating that team of who do you need around you. So learning an expertise and having an expertise that you focus on is really important, but not assuming you're the expert in the individual's life. And that's what we're seeing with the structural racism, is really how do you look at what matters to you as an individual. If you're in front of me and I'm here to help, what matters to you should be where we all start. Not what I think you need, not what I think I'm going to prescribe or my treatment plan. And then as educators, it's about who else do you need around you, that system of care. Because none of us have the expertise to do everything. And that care gets fragmented really fast. If we don't have social workers working alongside physicians, working alongside nurses, working alongside an employment coach or a housing support, all of those are important individuals in the individual's path to wellness. And we need to create those systems. So collaboration, teaming together, and partnering with the driver being the individual sitting in front of us that we're trying to help, that should be the core decision maker.
Mm-hmm. So teaming skills, skills around seeing structures that might be presenting barriers, which you seem to have throughout your career seen naturally, right? Yeah, and then making sure that we don't fall victim to the cult of expertise.
Yes,
right? I mean,
absolutely.
yeah, and I think that we've seen that a lot actually throughout the pandemic, is that the things that we thought we knew, we don't actually know. And so the challenge for us as an educational institution is to teach students how to truly think critically about the human condition, the cultures that people are coming from, and to see beyond their own culture and life experience. Yeah.
And even the burden that they're bringing in. We can't assume that we know what somebody is dealing with in that moment or in that week. And we had an audacious caseworker at one time early on in Hennepin Health get ahead of a provider who was going into the room who had treated an individual for years. And the provider went in and said, all of a sudden looked at a woman and she said, "Doc, I'm ready to talk about my medications." And he came out and said, "Gosh, this has been somebody, I couldn't get her to talk about her medications for the longest time. What did you do?" And the caseworker said, "Well, she's having problems with transportation. She's having problems with access to some services she needs in her home. I took care of those and got them out of the way. And now she was ready to have the conversation you wanted to have." But all of us as caretakers, caregivers, understanding what's the burden the person in front of us has, what matters to them in the moment, getting that resolved so that they can do additional work is an essential skill for everybody.
Yeah, I think that providing hope, healing, and opportunity so that human beings can truly flourish means not just understanding the physical condition that people are in, but the social and emotional condition that they're in. Are they depressed? What are their spiritual needs when they're coming to you? Because that establishment of trust early on is important, and also that changes over time. So it's really been interesting to kind of think about, in the healthcare delivery system, because the Morrison Family College of Health is into training, and the providers of healthcare into the future, not necessarily the business of healthcare. We care about the business of healthcare, but we're really caring about, what is delivery going to be looking like, and why is it different? Rethinking, if you think about the pandemic, why do you think it's important for us to take this moment in time to rethink healthcare as we know it? And then are there emerging trends that you're seeing and responding to that are different than in the past?
I think huge thing that I think the pandemic taught us is that first year in 2020, we didn't know what was coming. We didn't know how it was going, the longevity of it. And the state took some critical steps of getting rules and regulations out of our way. Mm-hmm. And it was suddenly back to just providing care. It didn't matter. And so we stopped the check boxes. We stopped all the regulatory chasing of all the regulations that we have in the provider's way. And those providers got to just start talking to people and making sure that care was at the forefront and that we had the ability to just move fast, move intentional, and move with our community. And I think if we can hold on to that outside of the pandemic, mm-hmm. is to say we can't overregulate. We can't have our documentation drive our interactions. It's that human, how do I help you in the moment? How do I make a difference? And how do we create a plan together that is so essential? And I think that's a direction that healthcare needs to hold on to. How are we flexible? How do we make access easier? And how do we take care at the forefront and not overburden providers with all of the other business side of things?
Mm-hmm. So healthcare, from your perspective, has really experienced what it essentially should be and is.
Yeah.
Right. All those networks, all those rules. I mean, they suddenly just started disintegrating. Right. Yeah, we saw that in higher ed too. In terms of accreditation, in terms of, we talked for years about, can we do remote supervision? And all of a sudden, these accrediting bodies were like, oh, I think we can do this. And
right.
there was just
that opportunity to
yeah.
innovate and do right
yeah.
because we were in a crisis moment. Now, if we can hold on to that and say, yeah. how do we do right all the time and not let some of those barriers? Mm-hmm. I often talk about identify the problem, be the solution. Mm-hmm. And I talk about that because, to your point about students and learning and finding problems, even teaching to a business case, you don't have to necessarily know the business of healthcare, but you need to know if you see a problem, all of us, our personal responsibility is to grab that problem and figure out the path. Whether it's grabbing a partner that can help you break through a problem, mm-hmm. But our job is to make sure that healthcare is working for the people it serves.
Yeah. I think one of the things I noticed during the pandemic too is that solutions got pitched a lot faster. Just possibilities, right? Yep. Okay, well, here's the identified issue. Well, sometimes the identified issue is wrong because you didn't understand the community you were trying to serve, right? And then, so it was like, okay, redefine the problem. And then just a lot of solutions pitching, like a lot of possibilities thinking. And I agree that if we can kind of hold on to that, it'll be awesome. We'll move a lot faster, and there'll be more benefit to improving health outcomes.
The chance
in the community.
to dream big
yeah.
and to not see the barriers, not to say, oh, but I'm going to hit against this regulation,
yeah.
or I'm going to hit against this rule. Just what's the right direction and how do we get there?
Right. Yeah. Well, and when you're delivering healthcare services, they're life-saving services. Mm-hmm. And so the stakes are also really, really high. And, I think that makes healthcare conservative in some ways with the types of bureaucracies, mm-hmm. I think, that develop around it. So I'd invite the audience to actually ask questions. If you have questions, we had some that were submitted beforehand. Okay. And I have to say that these are really intelligent questions. Some of them I don't even think I fully understood myself. So as others are thinking about what kinds of questions they might want to submit for Jennifer, I'll ask a few that came out beforehand. So one of the questions we received from the audience is, what initiatives do you have planned to diversify our healthcare workforce so it is actually more representative of the populations that are now living in our state?
It's a huge topic that every organization, every sector should be talking about. So we at Hennepin Healthcare, we currently are 35% of our team members. We have 7,000 team members across Hennepin Healthcare. 35% of them are people of color. But our goal is to make sure that every level of the organization is representative of the community we serve. And if the community we serve is 60% people of color, even though that's a good statistic, we've got a room to grow. So it's about recruitment, it's about retention, it is about how do you inspire. If I can share one thing we've recently done. So we knew we needed to diversify and we needed to create a feeder into healthcare. So our health equity team stood up black men with stethoscopes, and we have black women with stethoscopes. We have lots of other cultural communities coming right behind this. But what we found in healthcare is people don't often see themselves. And if they can't see themselves doing that work or don't know they can do it well, they don't know how to get there, they don't see themselves doing that work. This Black Men in Stethoscopes event was an inspiration. We brought in over 70 young men aged 12 to 18. And we brought them into environments where they could learn. They got to deliver babies. They got to draw blood in our simulation center. They got to do a robotic surgery. And when I talked to one young group, I said, how are you doing on this? Is it like video games? And they went, oh no, it's really hard. 5 minutes later, I circled back and they went, we're really good at this and we think we're better than some of your residents. And you quickly saw the sparks of excitement, and I can do this and I see myself in it. So then we were attaching mentoring and attaching internships to that. And you see that you've got a whole generation that now is in high school but sees themselves on a career path and has opportunities to come in with internships and mentoring and continue that trajectory. I think across all sectors, we need to be doing that exact same work.
Yeah, I think that's really true, that people can't be what they can't see, especially when they've never had that opportunity. And so that connection to opportunities to actually see people who are doing work that's quite different or see themselves in that work is really, really important. So the research basically shows that by the time a child is 12, they've kind of decided, am I going to be able to be a doctor? Am I going to be an engineer? Do I have aspirations about my future? So a lot of times I think about programs and I think we're not going young enough with exposure. Do you have any thoughts about that in terms of like how early on we need to be exposing young people? And it's really inspiring to hear the work that you're doing. Do you have other efforts going that reach into younger populations even?
So we have a plan to get there, really coining it as a talent garden. How do we kind of grow that talent generation over generation? So starting with 12 to 18-year-olds, and we will get earlier as well, and then creating those partnerships I mentioned. So when we did this, it wasn't just about Hennepin Healthcare. We had 3M join us, we had Starkey join us, we had the University of Minnesota join us in some of their research. It is about how do you create, again, an ecosystem that is just leveraging these opportunities to say you can be anything, and it's not about us just sending you into our organization, but it's about us bringing our community together and a lot of adults to say we're here for you and our jobs are to help you. So getting younger is absolutely necessary and critical. So we've got a plan. We're going to roll out this group. It was really fun. It was fun to see the young people at the end of the day. They got white coats with their name on it. Yeah. They were able to talk to their families about kind of goals or experiences. They were filling dental cavities in one experience. And so we had lots of people going, okay, I never thought about this, but now maybe I will. And to your point, if we can foster that in families and make it easier for families to even say, how do you have those conversations younger and younger, I think it's the right momentum.
Yeah, well, we certainly have a big healthcare shortage. I mean, in terms of health professionals, especially nursing. So we got to get to it.
We do, and some of that is getting the rules and regs out of your way.
Yes.
You know, we saw a paramedic shortage, so our team members created a paramedic academy and are reaching out to community to say, if you ever thought of doing this, and if so, we're going to not just provide the training, but we're going to pay you.
Yeah.
while you get the training, and we're going to help you get that next job, whether it's with us or somebody else. All of those career pathways, I think, are going to be essential for us to make sure we have a representative workforce.
Yeah. So I have a question here from an audience member about what do you think makes Minnesota and Hennepin Healthcare, the system, an attractive option for doctors at various phases of training?
I will say it is the hearts and minds. If you find, all of us want to follow our passion in our careers, and I will say the providers we have at Hennepin Healthcare have that passion for teaching. They have that passion to help you think through it on your own, to walk alongside you, to do shadowing. And so that passion is matched with excitement that we bring to students. So students really feeling like we're investing in them and we're investing in your success, and that's why we're all here. It is a significant portion of the work that we do. And the expertise that our folks bring in. So I think the skill, the specialization, and the fact that we are a large organization that is focused on academics and focused on that training makes it essential, because it's a part of who we are.
Mm-hmm. Yeah, so this is, so a lot of people think that you have to be a nurse or a doctor or, someone who was trained in maybe a specific type of delivery system in order to actually work in healthcare. But I think you're an example of, a special ed teacher who actually became, CEO of a healthcare organization. So do you have any advice to give for young people who are thinking about healthcare as a profession? Because I find that there's a fair amount of misconception out there in the community about who ends up working in healthcare. Any advice about how to think about careers to all the young people who might be watching today?
I think a lot about follow your values, follow your passion, because if it's not a job, if you enjoy what you're doing, you're in the right position, and your path will take you there. Don't overthink it. And where I found that the follow my values and follow my passion is anytime I did a job move, it was what drives me? What do I enjoy? What gives me energy? Because every day you want to get up and know that you're going somewhere and you're doing something you love. And I think if nothing else, understanding what you like and trying things, not setting limits for yourself. I think every job I've ever taken has scared the heck out of me. And I go, that tells me I'm pushing myself a little bit. Yeah. And then you go, oh, but I can do this. And guiding it with, trusted colleagues and individuals who can help you on that journey. But I do think it's for individuals, it's about find something you love and then keep trying new things. Mm-hmm. Never assume. Because I will say in the workforce shortages we have, we're getting more and more creative about how do we get pathways for careers for individuals, and how do we just make it easier for people even to come in our doors and experience something to find out if it's right for them.
Yeah. So making a living is not the same as having a significant life.
Yeah, absolutely.
I mean, that core lesson around opportunity, money, activities. I mean, I think it's something that's very much consistent with the values of St. Thomas. You can do a lot of things. Where do you want to contribute? How do you want to actually advance the common good? So I have a bunch of questions here, actually, from the audience about equity and just disparities generally. And some of these questions have to do with values-based purchasing, what's actually happening in that space. So obviously, people always talk about the quality of delivery. There isn't a code to crack with how we pay. And obviously, if you've actually gone to the doctor lately or, experienced any health delivery yourself, we're in a very fragmented system. Yeah. So how do you think about equity and value-based care, just payment systems? How do you orient yourself to kind of reconciling those things? I guess the easiest way to talk about this is we're living in a fragmented system. We want to do the right thing. We want to have good quality, but it's so hard to achieve. Yeah.
Yep. It's a great question, because what it talks about is that value-based care, and what we're talking about is outcomes. And when you think of the inequities in healthcare, one of the biggest things we did during the pandemic is we had a team help build, actually for the state, a database that showed us where we were getting outcomes by race. And it allowed you to level set and say, is everybody getting the same access? Where do we have gaps? Where do we need to strive and improve? So that data helped to drive us. And if we chase the funding, if we chase the fast wins, you're going to head somewhere else. You're not going to get the outcomes. So that quality and safety is about all of us laser focused on outcomes for healthcare. And if we can do that, we can drop costs, no doubt. So what we have done is we have found how do you define doing the right thing? What does it look like? What do people need? How do you pull in the data to tell the story that you're doing it differently? And then how do we go change the payment system or the rules and regs or the policies that are getting in our way? So start with doing right, and then go figure out how do we pay for it. And I think that's where the cusp we're at in healthcare is about, we know prevention and early intervention is essential to keeping people out of chronic disease. But if our systems don't pay as well for that as they do for acute care, that's some of our challenges. So how do we move the money and invest? And that's what Hennepin Healthcare has taken on. We have a chief ambulatory officer starting next week who is really being charged with coming in and saying, make prevention, early intervention, and wellness a top priority. And then we'll figure out how do we align those payment systems and get the barriers out of our way. But you have to do the work first and not chase the money. And I think that's what value-based care is all about.
Mm-hmm. Yeah, so I've got some questions in here around just race and racism and discrimination. How does that show up in healthcare? And then what are you doing to specifically address behaviors maybe in the workplace or things that you're seeing?
It shows up all over the place. And the more we all go on our own personal journeys, no matter what your cultural background is, we all see and experience the world differently. And as soon as you do that, you start seeing new things. And so we're taking it everywhere from our services. What in our services actually continue the racism and those inequities and outcomes? And then we have to grab those practices and retrain and change them. What in our business models does that as well? So we're looking at everything from who do we contract with, who do we partner with, and making sure there's diversity in that community. What is the systemic things that we need to do in healthcare to make sure that outcomes, maternal health outcomes for women of color is one example, Black women in particular, have significantly alarming different outcomes. And so how do we delve into that data and just say, so what does it take and how do we commit to changing the system as a result of that? And then it's also investing in our people, making sure that our team members, as we mentioned earlier, are representative of our community, but also have a voice at our table, have a sense of belonging, and are helping us as that critical partner in the community. So there's not a single rock any of us shouldn't be turning over, but it also takes courage, because you're going to find that we don't do it right all the time. But taking that leap of faith and doing right and knowing that we're heading in the right direction, I think all of us need to take that charge on.
Yeah, I find that the more diverse an organization becomes, oftentimes the less inclusive it gets. So achieving diversity is actually a lot easier than achieving inclusion.
Absolutely.
And being excellent at that is really hard. And so I think a lot of people get confused by terminology. And equity, which is what we're talking about today, is really about the actual results, right?
Absolutely.
The outcomes. But it's hard to get to if you don't minimally have diversity within your workforce, and then you know how to treat people so that they feel like they belong.
Yep.
And we see that with our campus and students who are coming here, that it's an environment where you have to kind of create that sense of belonging. And for each person or subpopulation or group, that might be slightly different.
Right.
I mean, our stakes in terms of doing it well is really about retaining students and having them have a wonderful learning experience, right?
Yep.
But I think about that in healthcare, and I think, wow, I mean, and fortunately or unfortunately, I grew up interpreting in health clinics.
Yep.
Because during the time when I grew up, there weren't interpreters. It wasn't reimbursable by Medicaid or anything, and I spent most of my childhood actually with my grandparents or with other family members in clinics, and really saw how on the front line, doctors and nurses and health professionals who were not from the Hmong community treating my grandparents as really people who were less than important individuals in society. And so that point of intersection, it's like people aren't a data point, right?
Right.
And so that belonging is so challenging. I mean, how do you think about that? Because I know that you've been working on promoting an inclusive climate and really moving towards equity. And obviously it's individualistic, right? It is that journey, but how are you doing that within the organization?
We're having conversations that are uncomfortable, that are contentious, and it's creating that safe community and safe table to have those hard conversations and to all stay at the table together and move forward with changes. And then it's that visible action. So I don't want to say we've arrived, because we haven't. It's a long journey. But that sense of belonging you talked about is so critical, because we could all recruit and do a great job, and if people don't feel like they belong, they're not going to stay. And we've actually done more harm at the end of the day, whether it's to patients, whether it's to the team members that we have. So creating that safe space and those learning journeys. So as a teaching organization, we often talk, we just talked the other day about that growth mindset and coming into it with a learning lens, and how do we hold each other accountable when we've taken a misstep or when we have something that we should be learning. But it's going to take us, especially in Minnesota, we have to have those conversations.
Yeah. So I have this interesting question here, because obviously it's all about electronic health records and interoperability with clinic systems and everything. So I have a question from an audience member who basically worked at Epic after graduating this past May, and is curious about your thoughts on healthcare software companies and how they affect your roles in healthcare. And then how do you think EHRs, just the way they've been set up, because yet another structure, have influenced how we focus on health equity?
Really deep question, and technology is, so when we look at workforce shortages, we have to get smarter in how we're using technology so that everybody and those human interactions are what we're focused on, and that technology is helping us make it easy. Get decision making done, get documentation done, get that out of our way. So I think technology has a huge role. It also has a huge role, you mentioned earlier, about interpreting. One of our early learnings on telehealth was with over 20% of our population speaking a language other than English. Telehealth was a real challenge early on. Until we quickly moved to say, how do we get our interpreters also in that same screen and make that real live experience? So our health records being accessible, being in languages that make sense to family members, being portable across that system of care are all going to be really important, so that we make that access easy and we make those partnerships. When we talk about partnerships, I can't hold all the data if I've got 5 partners in the community that's working with a family as well. It's how do we share that information together. So I think we need to do a lot of investment there, and we need to make it easier and faster and really less expensive.
Do you think that electronic health records, the structure itself, has influenced how healthcare is delivered? It
has, because it's how we document. It goes back to those rules and regulations. Doesn't matter how great the interaction was. If it's not documented, if it's not captured, it doesn't get paid for. And again, I think if we put that into the background and have that human interaction and that care delivery be at the forefront, that's where technology could help us advance care versus the focus on the documentation.
Yeah, so there's I've got a number of questions here from audience members around serving people with disabilities and serving kids with disabilities. How does Hennepin Healthcare do that and think about what really needs to happen with those populations?
You know, it's always about the individualization for the person. So whether that disability is an intellectual disability, whether it is a physical disability, whether it is a mental health disability, you know, kind of runs the gamut of how do we support individuals and what are their needs. What we try to focus on is what matters most to you and what can I do for you and with you. And so helping that be defined by the individual's perspective helps us make sure we're meeting their healthcare needs as well. We've got an incredible dental clinic that really focuses on individuals with disabilities because getting dental care can be hard for a lot of people. It can be really hard if you also have a disability. And making sure that we have providers that are trained in particular to work with needs that may be different and pulling them into strengths and how do we work differently. So I think in healthcare across the board, whether it's a disability, whether it's a cultural background, whether it's an age, you know, we're all different people and we have to be flexible enough to, again, not put people into a way of providing care and really figure out how we can best provide that care with them.
Yeah. Well, you're speaking to some of my passions here with teaching students and helping the community see that whoever is in front of them is an important person, and that the cultural competency skills that we need to bring have to actually be seen through the eyes of the patient and the person and the family, and not judged, so that we can actually provide the right level of care and the appropriate care that we want to deliver in the health delivery system. So unfortunately, we're running out of time here, so I'm going to have to wrap up. But do you have any final thoughts, or maybe something that you want to share with our audience that you haven't been able to share yet? We've had a really wonderful conversation. So
well, thank you. I've enjoyed it. I will say that I think we are at a pivot point for healthcare. I think we're at a pivot point as a community, whether it is the pandemic of racism, whether it is the pandemic of COVID that we're all dealing with. We have an opportunity as a community to come together in new and exciting ways and to innovate. But it will take every one of us grabbing that and owning what levers we can pull in order to make a different reality going forward. And I'm excited about where we're at because I think it's the right time, it's the right moment, and we're moving the right amount of work.
yeah, your comment about seeing it but having the courage to do it is really an important one for all of us to remember. So I just really want to thank you, Jennifer, for being with us today and sharing your insights with us. It's been a real pleasure. So I'd also like to thank our audience for attending and for providing questions. We hope you can join us at the next First Friday webinar on March 4th for an engaging conversation with Ozzie Nelson, Chairman and CEO of Nelson, and Karen McCoy, AVP of Alumni Career and Corporate Engagement at St. Thomas, about the post-pandemic workplace and what it means for our workforce. Thank you, and enjoy the rest of your day.